Okay, so this patient is a walk-in. This is a 54-year-old female with right flank pain, and nausea, no hematuria, so that's blood in the urine, and no history of kidney stones. Looks uncomfortable. Okay, let's go ahead and deal with this one. Oh, there's an attending physician. Okay, so we're just in the oh shit, I can look around the room. Wash your hands, kids. This is cool. This is actually quite cool. I really like the interface. Okay. Yeah, that's fine. So let's go ahead and get our numbers on straight away. Fine, so let's look at our picture. So we have somebody who is not side-nosed and can talk, so there's no airway concerns. Their respiratory rate is 18, which is fine. Their oxygen saturations are 99, which is fine. Temperature is fine. Heart rate is fine, and blood pressure is mildly elevated, but not significantly so. Okay. Alright, let's go for it. What can we help you with? What can we help with today? That means I got pro, but don't judge me. Yes, I got the pro one. I'm really enjoying this, actually. I can see myself doing this when I'm not there. When I'm not streaming it, necessarily. Of course, I wouldn't be doing it if I'm not there. You've been having really bad pain in your right side for the last couple of days. All down your right side, or in a specific place? It's mostly in your right flank, but also feeling some discomfort in right upper belly. Okay. This could... okay, alright. This could be... ooh. There's quite a few things this could be, actually. So, off the bat, I am thinking about possibility of... cholectitis, gallbladder, which is a problem I currently have. Bile duct is definitely one. And then this one is gallstones in the bile duct. So this one is yeah. Gallstones in the gallbladder, and then this one is gallstones in the bile duct. Also thinking in my head of oh, I don't actually think there is anything here for it. Okay, yeah, I'm also thinking of conditions to do with the liver as well, because that's going to be in that same area, but it's definitely too early to tell. Okay, fine. So when did the pain start? Pain starts. Typing is hard. Pain started 2 days ago. Okay. What were you doing at the time? At rest. At rest or moving. You wasn't doing anything special. Okay, so we weren't at rest, but we weren't doing anything really strenuous. So that's okay. What does the pain feel like? Is it a sharp pain, stabbing pain? It's a sharp pain. There's also a burning sensation. So I'm really thinking about the gallbladder kind of area. Yeah, okay. I've got very, very high suspicion for that now. It feels like a sharp pain. Oh, kidney involvement is still a possibility. Okay, there's also this burning sensation. Feels like a sharp pain. There's also this burning sensation. Do you have any other symptoms? Okay, so nausea but no vomiting. Okay. Oh, I missed one. Does the pain radiate anywhere else? And sometimes goes up to your belly, okay? That's fine. Is the pain constant, or does it come and go? The pain comes and goes in waves. Does it completely resolve? It just lessens, it never goes away completely. Okay, that's fine. Fine, so that's our timing. How long do the waves of pain last? Is it a few minutes? Is it a few hours? It lasts for a while, but can't. So I'm definitely thinking stones, because this is sounding remarkably familiar to my health. And they last for a little while, but I can't exactly say how long. Okay. Okay, fine. Does anything make the pain worse or better? So I'm not really sure what helps or make it worse. Okay. Does the pain get worse if you press the area? Okay. So yes, it does. Does the pain get worse if you take a deep breath in? Let's see. Okay. So remember what I said earlier. You know, when you think of your diaphragm, so your diaphragm is the muscle that kind of acts as a physical barrier between your abdominal cavity and your kind of thoracic cavity. You know, there's organs on both sides of it. When you breathe, your diaphragm moves quite considerably. You know, respiratory infections are a very common one that will hurt more when you take a deep breath in, but also with the movement of that diaphragm, anything that's infected or inflamed in the kind of upper abdominal area can also be kind of worsened by taking that deep breath in as well. So this is definitely pointing to something that is upper respiratory. I'm going to ask a very specific question here. I'm gonna see how this one does. Does the nausea get worse when you lie flat? Yes. Okay. Right. This is almost to a T my symptoms of my gallstones. Almost to a T, this is my symptoms of yeah. That's funny. That is hilarious. Okay, fine. Right, fine. On a scale of 0 to... What is the pain just now? It's about a 7 out of 10. Have you taken anything for the pain? I love this AI interface. This AI interface feels so accurate. We haven't taken anything for the pain yet. Do you have any medicine allergies? Do not collect 200 Vicodin. So we're allergic to penicillin. Okay, we'll need to keep that one in mind. We're allergic to penicillin that gives you a rash. Okay, fine. So do you have any health conditions? Seasonal allergies. Do you take any regular medications? Fine. Okay. Do you want something for the pain? So the reason why I asked this sounds obvious, but remember, consent is important for medicine. You should ideally be getting consent for everything that you want to do. You know, your patient should always be informed about what you are doing, and I like, you know, if time allows, why you're doing it. Yes, we did. So pain is a 7 out of 10, Mono. I think it's yeah, yeah, right where my fingers are. Yeah, consent is important. So it might seem obvious to somebody else that you know, the person is in a lot of pain and would like painkillers. But the truth be told, you should always get explicit consent. Some people, you know, you will find particularly men. But like people who are kind of age 40 to 60 in general sometimes like to be really stoic and hate accepting medications. So always get consent. Never assume that somebody will, you know, consent to this. But she's given us consent, so let's start her off with some acetaminophen, which we would know as paracetamol. So we are going to give that one. So we've done our Socrates, we've done our sample. Let's start moving on to our patient is improved. This is fine. So let's start moving on to this one. So airway I don't care about, breathing I don't care about. So well, I suppose these are the fine. So these are the ones that we can do without actually like sitting there and wasting time doing a lot of things. So I don't care about a head exam, I don't care about a neck exam, I don't care about a cardio exam. The pain, do you know what, the pain is worse when we take a deep breath in. So I think this isn't a waste of time to do a pulmonary exam. So clear auscultation bilaterally, no retractions, no wheezes, no rhonchi or rales, so that is fine. Now here's the big one. Let's do an abdominal exam. So we are soft, we are non-tender, we are non-distended, we have normal active bowel sounds, no percussion tenderness, no rebound or guarding. Okay, that's quite interesting. I wonder if there's some way that we can do... can we do a Murphy's test? No. So one of the things that you can do for somebody who has gallstones is what's called, you can look for Murphy's sign. So a Murphy's sign is effectively when you lie flat with your knees up or your knees kind of like, you know, bent in towards your chest. If you push right underneath the rib cage, it becomes excruciating. The text is too small, you're watching on a TV. I mean, I can try and zoom in if you would, if you know, I can try and jury rig something that would work if you want to see it a bit bigger, but it's a bit hard to kind of, you know, yeah, text is always an issue. Okay, fine. Let's have a little check of the gentle urinary exam. Again, we can't rule out kidney involvement at the moment. So let's go for this one. No discharge, that's fine. Hyperthesia of the right flank without CVA tenderness. What the fuck is... Hang on a minute. There's two words here I don't understand. Oh, okay. CVA tenderness is the Oh no. Okay, fine. So CVA is what's called the Murphy's punch, which is basically what I was talking about before for the percussion that you do on somebody's back to assess if you have a kidney infection. If you have a kidney infection, the Murphy's punch is fucking excruciating. Hyperthesia. I think I know what this one means. But I just want to make sure I've got the exact definition of it. Yeah, so thesia is generally like sensation. So when you talk about anesthesia, you are reducing the sensation. Hyperesthesia is too much sensation. So the abnormal increases sensitivity. So fine. So we're quite tender, basically. It's a complicated way of saying that one. Musculoskeletal exam, I think, will be fine. Oh, hello. Vestibular lesions on a slightly erythematous base without crusting. Lesions are present on the right thoracic region and the right lateral chest wall. Ooh, okay. Well, this is just taking a bit of a U-turn. I was so sure this was gallstones, but now I'm not sure. This could still be an incidental finding, but actually I am not sure. Let's check in with the patient. How is the pain now? Maybe a 5 out of 10. Okie doke. We can give you something stronger for the pain, if you'd like. Is it like the fetal position? Yes. Yeah, kind of. Yeah. Yeah. Something stronger would help a lot. Okay. This would be morphine, and would involve putting a needle. Morphine can. Okay, so we're explaining what's involved with the morphine. You understand, but you really need something for the pain. We can deal with that later. That's fine. Okay, so in this regard, we are going to insert an IV into the arm, which is now done. And we are going to give a morphine bolus. Oh, we've got more medicines. Okay, we're going to give a morphine bolus for the pain, and we'll see what that one does. Okay, this is hopefully going to improve the patient's pain score. We can see the resp rates come down, which is something that can happen when you're on morphine. Okay, let's have soft tissue. Yeah, okay, I think... Fine. I think I want renal and an upper quadrant ultrasound. Let's see what they look like. So ultrasound, the gallbladder wall is normal, no gallstones, negative Murphy sign. There is no hydronephrosis bilaterally. Okay, fine. So it's not gallstones. It's not gallstones. This kind of fucks me up a little bit. Okay, let's go for some lab work then. So let's go for... Okay, I don't care about an ABG. Basic chemistry. I think a basic chemistry is fine. CBC is going to be quite good. Lactate's going to be quite good. I can't rule out liver yet. So let's go for let's go for urinalysis, and let's go for LFTs and see what we are working with here. Can you do cultures from the skin pustules? Yes, I think so. I think we can. Okay, so there is nothing abnormal in the blood work. So this isn't a systemic infection that we are working with here. Let's go to imaging and let's grab a CT abdomen. And we'll do this one quickly. So CB abdomen is fine. There is nothing abnormal in that one. Let's check our other lab works. So, pancreatitis. Okay, we are going to go for an amylase, because that is going to tell us... can we do a gamma GTs, I wonder? I'm still worried that we might be dealing with some kind of infection, so... But I think this is more likely to be a skin infection. Lactic acidosis, okay. Okay, I can't see if any way of sampling this. So yeah, this vesicular lesions on a slightly without crusting. Okay. Let's do these tests and see if they have anything. So cultures are in progress. So yeah, we've got nothing abnormal in our blood work. The plot thickens. Plot fucking thickens. Okay, I'm happy it's not any of these. Infectious diseases are definitely an option. Dermatological. Oh. Okay, I don't think it's endocrine. I don't understand what kind of topical skin infection is going to cause this many symptoms. Not to say that it can, but these are some pretty severe symptoms. Stephen-Johnson syndrome. No, we don't have necrosis of this one. Toxin producing. I don't think it's necrotizing fasciitis. Okay, I think cellulitis is definitely one. Eczematous skin. Let's see. I don't think it's contact dermatitis. Do you know what? Let's speak to dermatology. Let's see what the dermatologist has to say. It seems like the patient might benefit from a course of antiviral therapy. Okay. Let's speak to the attending then. How can we help? Can we get some help with the diagnosis? So review the differentials. So cellulitis, okay. So nephrolitis are kidney stones, crystallization of substances within urine. Yeah, okay, fine. So that's kidney stones. Acute gastroenteritis. Fine. Cholectasis, lumbar strain, pneumothorax, herpes zoster. Actually, I didn't think about that one. The shingles is caused by reactivation of the chickenpox virus. It causes a vesicular rash. Hang on a minute, I need to Google what this looks like. Herpes zoster. Watch it come up with the first image that it's been. Yeah, okay, it's basically that one. Fine. Okay, but let's do this properly. So we've done the abdominal CT scan, which show. Oh, and we also did the kidney thing, which showed no kidney stones. We've got no gallbladder stones. The bone work in this one is fine. Pneumothorax, there's not a pneumothorax. Abdominal pain, NOS. Can't rule out abdominal pain, NOS. Given it is tender. Okay. So let's go for interventions. Okay. Is this a viral? Yeah, okay, fine. So I think it's going to be antivirals. But we can deal with that one later. I think you have a skin infection. Can we give you some antivirals? Okay, well. Okay, so basically this is a case of like a patient lack of understanding. So she doesn't think she needs antivirals, she's just focused on the pain. Okay, so what we're going to explain is that antivirals will reduce the inflammation, which will I've spoken to a specialist, and we think it will help. Okay, fine. There we go. It took us a while to get there, but we are there. So what we need is, oh fuck. I think it's gonna be okay, haloperidol, miscellaneous. What is an name me an antiviral medication. Let's see. So apparently acyclovir is one. That's down as antibiotics, isn't it? Oh, and yeah, okay, so antibiotics is for antivirals as well. Okay, fine. So herpes zoster, which I think is the one we've got. What was our other differential? Cellulitis, soft tissue beneath the skin. Okay, I think we go for acyclovir. Fine. Okay, let's speak with dermatology. Oh, we can't speak to them again. Dr. Hibblejaybob, please report stat to room 10. Dr. Hibblejaybob to room 10. Is your drink pink? My drink is pink, yes. It's a kind of pale rosé color. Fine. Hand off. Admit to the floor for a dermatology consult. I don't think we need to keep you in. I don't think we need to keep her in hospital because this course of antivirals is going to take a few days. We are on top of the pain for now. The obs that we are painting here is not the picture of somebody who is critically unwell, who needs to be kept in hospital. I think because of the morphine, we'll probably need to admit to ED observation until the morphine's worn off. But I don't think they need... I think this... Do you know what? Okay. Okay, I think we're gonna go with this one. If I was a clinician, if I was like a, you know, a real hospital clinician, I would keep them in hospital with, for a couple of hours to make sure the morphine had worn off without complication, and then send them home. But I think it's gonna penalize me if I don't do this one. So let's hand off here. Oh, okay. Okay. Yeah, not much to do here. Yeah, that one was fine. We lost 20% for our investigations. I'm curious as to why. Okay, because of the lactate. CT abdomen was on there. Okay, we did a lot of unnecessary things, but in our defense, those unnecessary things did really help us to rule out quite a lot of the differential diagnosis. This one didn't require testing. Yeah, that's fair. I don't know fucking dermatology shit. Fuck that. But we did things that we didn't need to do, but we didn't miss anything, so that's quite good. But importantly, we did nothing that's absolutely harmful, so this is fine. And yes, our disposition was quite good. Yeah, okay, another good result. Also, this is the ultrasound one. Also, this is the US, so admission means more charges. Yeah, this is true. This is definitely true. CME? What the fuck is CME? Oh, yeah. I can get medical credits for doing this as well. Which I think was quite good. Patient AI was once again fantastic. Yeah, no notes on that one. This is fun. I'm really liking this. I'm really liking this.
Could go easy on the team kills.
This bar.
Just saying.
Oh my god.
Are you fucking serious?
Where the fuck did they get picked?
What's happening?
Ow, what the fuck? You fucking bitch!
Oh, here he is. Ka-chow!
Get your dilly vegetables.
Strawberry isn't a vegetable, you fucking mortal!
Let's go! Come on! Yeah! Oh!
But I'm looking down to plant the bomb.
Yeah, but he could... Okay, just because you can't see him. Oh! You can say if you want to, you can fuck a hooker! Are we ready for the flesh?
Are you ready for Tony Hawk's pro flesh tunnel?
Throttle down, throttle up.
You're a wanker. Okay, I'm
Oh! Fuck!
What does the army say?
Fuck.
Fuck.
Fuck!
Fuck.
Oh,
fuck. Oh yeah. It's on you.
I literally can't move.
I'm spawned in the barrel of water!
You're really fast, and I am very good with ropes. That came out badly. Shut up.
We waited all this fucking time for you to download the game! And you fucking get yourself banned!
Doesn't hit as hard as life does. Jesus Christ, that was deep. Who hurt you? Shit.
Say the word exterminate.
Just up, down, there, right behind you, up the stairs. There we go.
No, that's my character! Oh, I got it. Ah! Fuck! Fudge! Oh lord, he's right there! What? Stop the zombie apocalypse, I want to talk about paddle steamers! What are you doing, aircraft? Fuck, I'm dead. Not good, not good, not good!
Why is it a planter in the fucking hallway?
Well, because that's where I'm gonna grow my fucking plants, innit? Come cannon! Fucking die!
Bunny talks more like this. No, wait, that's not right. Choity toity woities. That's.
There's a cloaker! Oh lord! Oh yes! I shuriken the lights out of that!
Why have I been sent to prison?
Oh, holy fuck! That motherfucker just sank the bus. Do you have any idea how many broken bones you have?
I'm a jellyfish.
Fuck! Fuck! Fucking dumbass.
God damn it!
Absolute fucking.
Why did that not go through?
Cause you suck. What the moon doing?
Bitch, I can't be outnumbered. I don't know how to can. That's a fucking threat. Okay.
Then beat him the balloon. I thought you were gonna hit us up with the Roger Roger in that voice.
Roger, Roger.
Speed sign. You... Fucking hard mode.
Ah, you bitch!
Okay, that's no bueno. This is no bueno. This is very no bueno. Alright, let's just abandon.
Surprise, motherfucker.
Oh! We can break this with all the people inside. Oh, fuck yeah, we can. Fuck yeah.